Okay. Good evening, madam. Good evening.
Yes, sir. Monday, sir, is here, I think. शहे 85तम जातीय आभासी कार्यक्रम रे एक बिंदु रे जोग देइथिबा समस्त दर्शक माननकु मु डॉक्टर नमिता पटनायक असिस्टेंट स्टेट कमिश्नर ओडिशा स्टेट भारत स्काउट्स एंड गाइड्स तथा फैकल्टी इकोनॉमिक्स महर्षि कॉलेज ऑफ नेचुरल लॉ बीइंग द होस्ट एंड कन्वेनर ए गूगल प्लेटफॉर्म को समस्त को स्वागत करनछु। जय जगन्नाथ, शुभ संध्या, गुड इवनिंग। चतुर्भुजो जगन्नाथ कंठ शोभित कौस्तुभ पद्मनाभो वेद गर्भश्च चंद्र सूर्यो विलोचन जगन्नाथो लोकनाथो नीलाद्रिशो परहरि दीनबन्धु दया सिंधु कृपालुर्जन रक्षक कम्बुपाणिश्चक्रपाणि पद्मनाभो नरोत्तम जगतं पालको व्यापी सर्वव्यापी सुरेश्वरो लोको राजो देवराजो शक्रभूपश्च भूपति नीलाचलपतिर्नाथ कृतन्था पुरुषोत्तम ताक्षोदेय कल्पतरु विमला प्रीतिवर्धन बलभद्रो वासुदेव माधव मधुसूदन वैतरी पुंडरीकाक्षो वनमाली बलप्रियो ब्रह्म विष्णु वंश मुरारी कृष्ण केशव श्रीराम सचिदानंद गोविंद परमेश्वर विष्णु जिष्णु महाविष्णु प्रभु विष्णु महेश्वर परम कारुणिक अनंत कोटि ब्रह्मांडर मौड़मणि कोटि कोटि ओडियांकर हृदयर आराध्य देवता समग्र विश्व चराचर स्रष्टा आनंद कंद परमानंद सचिदानंद अखिल रसघन विग्रह विश्व वेदनार वैद्य देवाधिदेव श्री श्री जगन्नाथंकर चरण कमल रे किंचनर कोटि कोटि धन्यवाद। I offer my respectful obeisance unto the lotus feet of our spiritual Guru, Lord Sri Jagannath. I, Dr. Namita Patnaik, the Assistant State Commissioner of Odisha State, welcome all the dignitaries to this Google board. Respected Principal Professor MANJU Patnaik, the President of this 185 National Webinar, being the Principal Mahorshi College of Natural Law, I welcome you, Madam, to this Google board. Dr. KP Mr. Sir, the State Chief Commissioner, Chief Patron of this webinar, I welcome you, Shia. Respected Mr. Dilip Kha, the overseas participant from New York, USA, who will propose a vote of thanks. Welcome you, sir. Dear Dibbansu, Sweetie, Bismita, all the volunteers of my team members of the National Webinar team, and respected all my colleagues, friends from abroad, friends from other than Odisha, and for their support, their timely assistance, and their quick help and immediate response. So, finally, I welcome one and only the most energetic, vibrant, very polite, very positive attitude, loving personality, the chief speaker and the resource person of today's evening, Dr.Mahendra Tripathy, the renowned cardiologist, the one of the best cardiologists of our country. Let's welcome him virtually. May I request our friends to please share your emotion, sticker, whatever you like, to welcome our sir. Hearty welcome, Dr. Mahendra Tripathy ji, the cardiologist from Care Hospitals, and the only one who has got international repute.
Thank you, madam. Thank you.
Now,
Thank you.
welcome, sir. Now it's time. I'll request our Chief Patron, Dr. K.P. Mishra, sir, the State Chief Commissioner, Odisha State Bharat Scouts and Guides, and the Senior Most Vice President to inaugurate this webinar virtually. Now I request the Bansu, please enchant the sloka.
Okay. दीपम ज्योति परम ज्योति दीपम ज्योति जनार्दन दीप हरतु मे पाप दीप ज्योति नमस्तुते शुभम करोतु कल्याणम आरोग्यम सुख संपदा देश बुद्धि विनाशाय आत्म ज्योति नमस्तुते आत्म ज्योति प्रदीप्ताय ब्रह्म ज्योति नमस्तुते ब्रह्म ज्योति प्रदीप्ताय गुरु ज्योति नमस्तुते.
Thank you. Thank you, Dr. Mishra, and thank you, the Bansu. And today I'm very glad to inform all of you that today is the birthday of our one and only the Bansu party. On this auspicious day, I'd like to wish him, and I'll request all of us to wish the Bansu happy birthday.
Thank you to all.
Happy birthday.
Happy birthday,
Thank
Vida.
you to all.
Okay. Sure. Now, we know heart, it pumps blood throughout our body, controls our heart rate and maintain blood pressure. Our heart is a bit like a house. It has a walls, rooms, doors, plumbing, and so many electrical systems are there. But all the parts of our heart work together to keep blood flowing, both oxygenated and deoxygenated, and send nutrition to other organs. So nothing more to say about hearts, because we all love heart and we like to also share our hearts. But let us listen from Dr.Mahendra Tripathy, the MBBS from Utkal University, I meant to say, from this Utkal University, who has pursued the degree in 1982, and he has done his MD in General Medicine from Sambalpur University, and he did also DM Cardiology from Sambalpur University in 1986. Nothing more to say about, because as you know, he is a very well-known member of the Society of Cardiovascular Angiography and Intervention and Cardiology Society of India, and he is working since 40 years back under the banner of this care hospitals. And everybody knows, having an international reputed figure with us, I'm really delighted, sir, and nothing more to say. To know about the health status of our country, it is well known to all of us. But the only valuable organ that is with us, it is nothing but the heart. So how to take care of this, let us listen, and how it functions, and how this small, very valuable organ is playing important, vital role nowadays. So let us listen from Dr. Tripathy. Now the floor is with you, sir, and the deliberation will be start very shortly. And I'll request, sir, please start with your speech. I'd like to say, sir.
Okay.
Okay,
Good
sir.
evening, madam, and esteemed guests. So I'm audible, madam.
Yes, sir. Yes, sir.
Okay. So from where shall I start? Which one? Who? Because this is a vast topic. So
Yes.
which one I will start? Okay.
Sir, Rajiv, we are गोटे कथा सर खाली कहबाकू मन अछि जेतेबेले बुढी मां जेजे मां हमको गप कहउतिले कुंभीर आ से माकड़ कथा माकड़ कहउतिला मु कलिजाटा छाडी देई आसी सेतेबेले हमें भाबुतलु ए कलिजाटा କାହିଁକି ମାଙ୍କଡ ଛାଡି ଦେଇ ଆସିଲା ବୋଲି କହିଲା କିନ୍ତୁ the story begins like that and we are all very fond of our heart so ଏ heart କୁ କେମିତି କେୟାର ନବା ସାର୍ ଆଉ ଆଗାମୀ ଦିନରେ heart ର ଯୋଉ 7ଟି ଫଙ୍କସନ ଅଛି ଆପଣ ବହୁତ ସୁନ୍ଦର ଭାବରେ YouTube ରେ କହିଛନ୍ତି we want something new and some very few people are dying in other disease rather than heart attack so this word is word ଟା ଶୁଣିଲେ ମନ ଭିତରେ ଗୋଟେ ଭୟ ଆସି ଯାଉଛି ସାର୍ ତେଣୁ କାହିଁକି ଏଇଟା ଏ ବିଷୟରେ ଶୁଣିବା ସାର୍ ଆପଣଙ୍କ ଠାରୁ
Okay, madam. Okay. Thank you. So, I'll start with, I think, primary prevention. That is, before the disease sets in, because what we see, English
okay sir okay sir
that's
yes,
okay.
Sir. But we want to see your videos.
Yes, so
there are many people from outside India, so they want to see you, sir.
Okay. So, video, okay, I'm trying. Yeah, video.
Nice, sir. Asuni video.
Cancel. So, the kotha koile kindly. Huh. So, the ଆମକୁ ସେଟା ମୋବାଇଲ ଦେଇ ସେ ଲାପଟପ କଣଟା କରୁଛନ୍ତି
Yes, sir.
Okay, madam.
Our topic, yes, sir. Our topic, as you know, sir, time is life itself, and life resides in the human heart. So, life टाକୁ किपरि भाବରେ समय सहित आमे ताଳ ଦେଇକି sir ଆଗକୁ नबा ए विषୟରେ सर start करिवा.
Okay. More to start with, time period, madam, is half an hour or 45 minutes. How much?
So, whatever you like, sir.
Okay.
The floor is with you.
Okay. So, I'll start with most important is primary prevention of cardiovascular disease.
Yes, sir.
Primary disease, a cover to the bed. Which burdens you may. So, primary prevention of cardiovascular disease, as you know, the number one cause of death globally is cardiovascular disease. This is the number one cause of death. That is the most number one non-communicable diseases. So, in India or Asian country, disease it is coming much earlier. Earlier it was 10 years. Now it is happening 15 years earlier than Western countries. For example, the average age of a coronary disease in USA or Europe is approximately 50, but in India or Southeast Asia, it is coming 35 or 40.
Sir, voice टा आसुनी freeze ହେଇଗଲା.
It Madam, 1 minute. I'm changing over to my
Yes, sir.
laptop
Yes, sir.
because it may be
I guess.
1
I guess.
minute.
number 96546.
6.3. Okay. Now, madam, audible?
Yes, yes, sir. Yes, sir.
Okay.
Yeah, very much.
So, as I told you, this is happening, but very what we call it a accelerated atherosclerosis. जो process disease process टा हुए, এটা कुहा जाए atherosclerosis. Atherosclerosis माने ब्लड रे जो फैट रहता है, सेडको कोरोनरी आर्टरी जमा ही जाए, तापर फाइब्रोसिस हुए, सेडा हार्डनिंग हुए, सेठी अल्टीमेटली नैरोइंग हेकरी एवं प्लेक रप्चर ही जाए, प्लेक रप्चर हेकरी हार्ट अटैक हुए, सेटा कुहा जाए atherosclerosis process. मोस्टली आपनकर हार्ट डिजीज भितर जोटा मोस्ट इंपोर्टेंट कॉज कोरोनरी आर्टरी डिजीज विषय कहूची, अलगा सब हार्ट डिजीज जोड़ा अछि आपनकर हाइपरटेंशन अछि, वाल्वुलर हार्ट डिजीज अछि, पेरिकार्डियल हार्ट डिजीज अछि, प्राइमरी हार्ट मसल डिजीज अछि, आरडीएमएस अछि, सेगुड़ा को टच करनी कारण से माने दैट इज सेपरेट सबस्पेशलिटी ऑफ कार्डियोलॉजी, किंतु व्हाट इज मोस्ट इंपोर्टेंट फॉर डे टू डे तारी ऊपर विशेष भाव कहि. सो ये जो एथेरोस्क्लेरोसिस जो प्रोसेस ता होची
Sir.
हमर इंडियन मानकर 10 और 15 वर्ष अर्लियर होची इन कंपैरिजन टू वेस्टर्न
To other countries.
कंट्रीज. ये रोगों द्वारा हार्ट एटीट्यूड को सिमिलर टाइप ऑफ जिंस होची. सो atherosclerosis process ता केमथि होची, how it is the atherosclerosis most commonly in Asian countries it is common cause is hypertension. What is important is nowadays you'll see obesity is becoming more and more important in Indian patients also, and smoking or tobacco in any form, tobacco use in any form, physical inactivity, even psychosocial stress in the life. So these are the very important conditions. Abhitar modify what we call modifiable causes and non-modifiable causes. Modifiable causes soda hoche amaro lifestyle, food style. One, number two, activity or exercises, tobacco smoking, physical activity, stress management, এবং early এবং কোলেস্টেরল, এগুলা হচ্ছে আমার মডিফাইবল ফ্যাক্টরস. নন মডিফাইবল হচ্ছে ফ্যামিলি হিস্ট্রি অফ হার্ট ডিজিজ, অত রেয়ার প্রেসিপিটিং ফ্যাক্টর যেগুড়াক ଅଛି সেগুড়াক এবং এজ আমি মডিফাই କରିପାରିବାନି. সো এই କେତେଗୁଡାକ ଅଛି ନନ୍ ମଡିଫାଏବଲ. ସୋ ମଡିଫାଏବଲ ଜିନିଷ ଆମ ହାତରେ ଯେତିକି ଅଛି ଦ୍ୟାଟ वी कैन डू. ସୋ somebody may ask also, we have taken care of everything, still we are suffering from my blood pressure देखिदेले, diabetes देखिदेले, cholesterol पे ओषध देइदेले, lifestyle change kale, exercise kale, still then also somebody is getting a problem. So set up on the residual risk factor data, which is not 70% approximately is or now still unknown. So those are called risk factors which we do not know, and we are working on that. We will know something regarding all those unknown factors. So এই যেতিগুড়া ମୁଁ ଆପଣ factor କହିଲି coronary artery disease ବିଷୟ କହିଲି, it is earlier in Indians, it is severe in Indians, and the death or mortality and morbidity is high in Indians. The response to treatment, that is also less in Indian patients. That means this disease is very takes a very bad course in Indian people. That's why it is called malignant atherosclerotic disease in Indians. So the both important how to prevent this atherosclerosis process, which is very important. ତାପରେ ଯେତିକି ଅଛି diet ଯୋଉଟା ଅଛି କଥା ହଉଛି ଆମ diet ଆପଣମାନେ ଯୋଉମାନେ ଜାଣିଥିବେ ସବୁ European diet or American diet, ଆମ diet how different, totally different. So we have got two types of heart healthy diet, two types of diet recommendation achi. One is Mediterranean type of diet, another is DASH diet. DASH hoche dietary assessment to prevent or to stop hypertension. So after the details I'm giving. First hoche salt intake. Salt intake has to be extra salt. That means extra salt in the diet. That is 1 TSA, 5 gram. That is equivalent to 2.4 grams of sodium. So common salt 2.5 gram, extra is allowable. Beyond that, it becomes extra salt intake. One. Now number two is the diet should be more of potassium. Potassium means it is mostly fruits and also banana. So these are the substances where more of potassium is there. I think there's a lot of importance to 2023. There is a guideline by ESC guideline asila, je hypertension prevention pai, particularly in Indians, hypertension is a very important predisposing factor. कहीं ना कारण टा कही भी अपन को कारण एटा तो बहुत बड़ो एक्सटेंसिव जिनसटा तो सो मते सबुडा कवर करिन किंतु केतोडा मिथ एंड फैक्ट विषय मु अपन के कही भी तापरे क्वेश्चन आंसर जति किछि थिबो कहि कारण दिस इज रियली अ वेरी बिग वन. Here I can just madam, I'll join from the laptop.
Yes, sir. That will be better. Yes, sir. Yes, sir.
Hello.
Yes, sir. Okay.
More awareness okay फिर कौन सी अच्छा मोमो से that's oh, this is on. Okay, so you can hear, madam.
Yes, sir.
Okay, so I'll come to hypertension. A simple facts I'll tell you. Keତେବେଳେ patient blood pressure will कहिबे. Guideline differ करछि. American guideline is different. European guideline is different. But whatever may be, if the blood pressure level is more than equal to 130 by 85, hypertension will stamp hella. 130 by 85. This is according to ACC, American College of Cardiology guideline. The European Society guideline is 140 by 90. Question is now how to measure blood pressure. How to measure blood pressure. So this is such a difficult thing. First time in the office, suppose doctor office chamber first recording will be always highest. One. You measure after 5 minutes, it will be less, and ultimately after 10 minutes or so, it will be normal. Same thing if you ask the patient, they measure the blood pressure at home also, that remains normal, but when they come to the doctor's chamber or hospital, it goes up. So it is office hypertension. So this is a very common thing. This happens approximately 30 to 40% of cases. So question hochi ताले जो पेशेंट आसिला फर्स्ट टाइम आपण बीपी देखले आपण स्टाम्प कर देले जे तुमर ब्लड प्रेशर अछि किंतु इन फैक्ट यदि से पेशेंट जी घरे मापिला 5 थर 7 थर मोर तो नॉर्मल अछि but we have started medication, so in that way we are incorrect. हमने से पेशेंट को उठे hypertension stamp कर देले माने we have wrongly given a disease and also wrongly started a medication, and that too again lifelong with its adverse effects or side effects. So in that case, एक importance हमर जो आपन कहली मैडम 2023 guideline जो आछि यूरोपियन सोसाइटी रो, the importance has been given to home BP monitoring. घरे अपन जो BP मापुचंती, that is more correct than the BP being measured in the hospital or doctor's chamber. So that has to be taken into consideration, number one. Number two, in different situations, suppose out of term chamber, it a white coat hypertension, out of masked hyper. Mask man kono, ଆପଣ ଆସିବେ ଅଫିସରେ ଦେଖିବେ ଚାମ୍ବରରେ ଦେଖିବେ ବିପି ଟା ନର୍ମାଲ କିନ୍ତୁ ପେସେଣ୍ଟ ଦେଖୁଛୁ ଅଧିକା ଘରେ ଘରେ ବିପି ମାପୁଛନ୍ତି ଅଧିକା ରହୁଛି. So this is called a masked hypertension. The masked hypertension ଟା more dangerous than white coat hypertension. କାରଣ masked hypertension more often they are having hypertension. So এই ସବୁ confusion create କରିବା ପାଇଁ ଆମର 24 hours ABPM ଅଛି ମାନେ 24 ଘଣ୍ଟାର ବ୍ଲଡ ପ୍ରେସର ମେଜରମେଣ୍ଟ ହବ. ସେଇଥିରେ ଆମର ଯୋଉ କ୍ରାଇଟେରିଆ ଅଛି the mean blood pressure level, daytime blood pressure, nighttime blood pressure, average blood pressure, early morning surge, this सब ଆମର क्राइटेरिया पांचटा अछि. সেই অনুসারে will stamp the patient as hypertensive not. So mo କହିବାର ଉଦ୍ଦେଶ୍ୟ ହେଉଛି ଜଣେ patient କୁ ଆପଣ blood pressure ଅଛି ବୋଲି କହିଲେ ମାନେ it is a lifelong disease. blood pressure ତ କେବେ ଭଲ ହବନି ଏକ ଆଉ patient को medicine देबे से पेशेंट मेडिसिन खाइबे मेडिसिन सब मेडिसिन साइड इफेक्ट अछि पाद फुललान तो मुंह फुललान तो पल्स रेट कमी गला सब हबो. सो इंपोर्टेंस होछि ब्लड प्रेशर स्टाम्प करिया आगरो अनलेस इट इज वेरी हाई. सपोज फॉर एग्जांपल जनकर 180/110, so it will be presumed that he is having severe hypertension. सेठी अपन ड्रग आरंभ कर परिबे किंतु जमन 140 50/85 90 रो सेमनकर I think it needs careful monitoring, preferably at home, with salt restriction, fatty food restriction, regular exercises. This मतलब after 4 or 6 the number of recordings and the gap is more weekly interval level, then it gives more or less a good information. ये blood pressure measurement. Treatment कथा we won't discuss treatment. Diet कथा हम कहतली salt restriction रहिला. I'll come
more potassium.
More of potassium. I'll come to the oil part little or later part. Later on, there is it's more of green leafy vegetables. Green leafy whole grain. What is important that is whole grain, because that whole grain contains more of vitamins 1, number 2 more of fibers, so in that way they control the cholesterol level much more, and the chances of rise in the cholesterol or triglyceride is much less. Whole grain, and in any food which is refined has to be avoided. Refined food to be avoided. Green leafy vegetables, grain, salads, and fruits in any form except in diabetics, where the some of the restriction the foods, otherwise no restriction for normal people. And then is regarding non-veg items, is small fish, big fish you have to remove the skin, then the slim chicken pieces, mutton also slim mutton pieces, it can be taken normally also. And regarding eggs, there is a lot of confusion. I think myths are there. So the present ACC or National Health Guideline of USA, one can have a, whole egg, 4 to 5 eggs per week. the fat in the yellow is easily assimilable and rarely gives rise to increase in the fat level. So this is a myth. So one can have 3 to 5 whole eggs per week if he wants. So it is not necessarily that one should take only egg whites. Okay, this is a myth and a lot of controversy regarding this. And next is oil. What is important? What should be the best cooking media oil in the house? So lot of controversy still it persists. So the National Institute of Nutrition, Hyderabad, we have got a decision. So what I have seen, I won't go into detail. You have to see the ratio of the N6 and N3 fatty acids, and accordingly you have to prescribe. But the summary I'll tell you: if you take a 30-70 mixture of a oil, for example, rice bran 70% and your mustard 30%, that is the best combination, and the amount is 15 ml per day. 15 ml per day. These are uses, and one can use in exchange. One can take also sunflower oil. You can take also groundnut oil also. Regarding olive oil, I think one thing is this is this is taken as in the raw form. Raw means if you are taking salad, you put it, but if you cook it, no, the all properties are lost. So similarly, all these oils, if you overheat, they become oxidized, and all are transformed to trans fatty acids and also saturated fatty acids. So they lose their property once you overheat. So there are some clue tips regarding this. Oh, don't purchase oil in a bulk because if you store at home, then it chances of being oxidation is high. One, two, you should keep in a cool and dry place so prevents oxidation. It should not be exposed to the light. Don't overcook the oil. If you are overcooking, then you discard that oil and use fresh oil. So the type of oil I told you, this depends on the type of fatty acids they contain. N6 or N3. N3 is what you usually sometimes they will take the omega-3 fatty acids. That is N3. N6 is docosa hexanoic acid, and it is not heart-friendly oil, so its use has come down. And regarding I forgot regarding the fish, one can have a sea fish. The oil in sea fish like a salmon or whatever maybe is all omega-3 fatty acids. Omega-3 fatty acids. So if you see the type of the way the people take fish in Japan, in European countries, it is almost half cooked. It is only boiled, no oil, nothing. So that in that way, the properties of a fish is maintained. The oil, what is there, it is omega-3 fatty acid. It is utilized in the body. So that is important. But what we take in our country or Asians, it is totally different. Overcooked, totally overcooked, fried. So this is totally different to our Mediterranean diet and also DAS diet. So, what maybe that I'll come to that later on. Then regarding the physical activities, I think everybody will know. We tell regarding physical activities, we don't do. Nobody does physical activities except maybe 2% or 5%. So, what is important is physical activity has a lot of positive effects on the health. First is your body figure is being maintained. You become a hard-working person. 2, 3, It regulates your blood sugar, regulates your cholesterol level, regulates your hormone levels. So that is a lot of positive effects of exercise. So type of exercise, I won't go into detail. There are three types of exercise, either isotonic exercise or isometric exercise or a combination of exercise. But the summary, the exercise program has to be regular. It has to be regular. Otherwise, I have done 2 months, then not weather is not good, this is not good, so I have not done. So that is of no use. And it should be regular 150 minutes of moderate intensity exercise per week. One may take 2 days off exercise in a week, but it has to be regular, and 5 days in a week must 150 hours, sorry, 150 minutes
Minutes.
per week, moderate intensity. If somebody is engaged in high intensity exercises, then it will be 75 minutes per week. What is important is it has to be a regular exercise program. But it will contain 70% of isotonic exercise and 20% of isometric exercises. Then regarding physical activity, I told you. Then tobacco, and I need not tell anything about tobacco. It is all harm. So in any form it is taken, it is harm. So it has to be discouraged through and through. So there is no question of concession
Any cost.
at any cost. Regarding
Is there?
regarding, I think, physical activity, I think most of the Indians, I think, what these premature coronary disease, the reasons may be physical inactivity. One, physical inactivity, because you see, we're not active. We don't run. We don't go for jogging. Nothing. We don't do anything. So physical inactivity is a part of our life.
Yes.
It is taken as a this should remain just like a food habit. This has to there. And regarding I think psychosocial stress, because that will remain, that is the intensity and severity very high in Indian or Asian countries, where those are developing countries. That will remain with improvement of the socioeconomic status of the country. That will improve, because there is no solution for that. Because everybody has to think of how to work, how to earn, how to have a livelihood. So that remains. But sometimes maybe one has to find out some little solution, so that its impact on the health will be little lessened. That is important. Then I'll talk regarding cholesterol level, because there are many myths and facts regarding the cholesterol. So regarding the latest guideline 2023, so they have divided like this. Somebody may जान के पचेरबे cholesterol टा मोर कोन कते मोर एतिक अछि कोन करबी.
Yes.
So what is the answer? So ମୁଁ ଖାଲି broad summary କରିଦେବି. ଯେକୌଣସି ପେସେଣ୍ଟଙ୍କର କି ଲୋକଙ୍କର clinical atherosclerotic vascular disease, for example, ତା ମାନେ ହଉଛି heart attack ହେଇଛି କି heart attack ହବାକୁ ଯାଉଥିଲା, brain stroke ହେଇଛି, କିମ୍ବା ଗୋଡରେ କୌଣସି artery block ଅଛି, କିମ୍ବା investigation ବେକରେ artery କୋଉଠି block ଅଛି, ଟିକେ even mild, all mild, even ଗୋଡରେ କୋଉଠି artery block ଅଛି, ସେଟା କହନ୍ତି clinical SCVD, atherosclerotic cardiovascular disease. ये जो ग्रुप टा है ना, so atherosclerotic disease माने होची, it is a pan atherosclerotic disease. Means it is there wherever the blood vessel is there, it is there. not only in the heart. After artery habo, brain habo, peter habo, goder सबड habo, because heart rele patient को pain habo, and once it happens it may be fatal. So that's a lot of importance to this area, but it can have appear, or it can happen to the brain with a stroke, kidney with renal failure, leg with gangrene, everything can happen. So this SCB kuachi, any patient ko every out history achi, this patient na starting jo dia jo atorvastatin commonly am de jauchi. So there are three forms of administration. One is high intensity. High intensity means 80 milligram. So जो मान को clinical atherosclerosis अच्छी, समाने सबो 80 milligram लखा per day नेबे, per day must, no compromise. एक है. दूसरा जो मान को LDL cholesterol is more than 90, समान भी 80 milligram नेबे. 2. Number 3. जो मान को diabetes अच्छी एवं age होची 40 to 75, all should be on moderate intensity statin at least 40 milligram throughout life, and at that time the cholesterol level को किसी देखा जीवन. इस condition रे we don't see the level of cholesterol. जने पचारिबे जे हमर तो cholesterol normal है ये लानी, मुझे उसको तो खाइबी कि नहीं? No, you have to take it lifelong. जो मानकर क्लिनिकल एथेरोस्क्लेरोसिस अच्छी, even if LDL cholesterol 25 HB, you have to take 80 milligram lifelong. 190 above अच्छी 80 milligram lifelong. Diabetes 40 to 75 years, statin 40 to 80 milligram lifelong, irrespective of lipid profile. Lipid profile देखा जीवन तक one may go see that, but if it is normal or less, no question of discontinuing. How the subset of patient ଅଛନ୍ତି, ଆମର SCBT score ଅଛି, atherosclerotic cardiovascular score, that is a US based scoring system. Our aim होची in 10 years रे chances of getting a atherosclerotic event, a heart attack or a brain stroke or a peripheral vascular disease, that probability केते. So around 9 variables achi. It is available in the, I think, Google, no problem. So if the chance is more than the 10 years SCBT risk is more than 20%, this will be also on statins lifelong. Some statins lifelong. And another group is when the score is 7.5 to 20% with multiple risk enhancers. Risk factor conventional risk factor called, there's a group of list is there, clinical and laboratory investigation, that is called the risk enhancers. When the risk enhancers are there, this group also gets a moderate to or intermediate to high dose of statins. So there is no controversy regarding statin. Why you are telling statin, why not other drugs? Because this is the drug which has proven that it prevents or postpones the atherosclerotic process and heart attack and stroke. This is the drug which is proven beyond doubt. So upon the primary prevention, pacharibe ko drug tam kon oshod khai mat kontu, only statin, atorvastatin or rosuvastatin. And sometimes journal kaibe je aspirin khaibi, more aspirin khaya darkar. So that aspirin controversy is, I think, no more there, because in 2019 and 20 there are 3 large randomized trials. Earlier we used to prescribe also aspirin, those are having diabetes and no coronary disease or no SCPD. I mean, those समझते and the large study no, it is not. It is beneficial in preventing a heart attack, but at the expense of increasing intracerebral bleed, brain bleeding अधिक होची एवं पेट जीआई ब्लीडिंग की अधिक होची सो यदि नेट बेनिफिट एंड रिस्क की एनालाइज करा जिवो it does little more harm than benefit. So that's why its use as a primary preventive agent, aspirin, is now no more there. But somebody may individualize a patient. Suppose if somebody is having long-standing diabetes, 20 years, 30 years diabetes, এবং cholesterol अधिक আছে সেটি one may individualize. That depends on the patient and doctor to decide whether to prescribe aspirin or not. Otherwise, its role as a primary preventing agent is over. So
what is the alternative, sir, for aspirin?
No, we won't give. No, we won't give because aspirin is an antiplatelet drug. Our kamala to clot हबार थिबो जो जगह रे अथरोस्क्लेरोटिक प्लेक आपन को एक फिगर देखा जेबो नै कहि परिबिने
Sir.
एक फिगर ता देखा जेबो कि नै
Yes,
क्लियरली
sir. Yes, sir.
नॉर्मली होची अटेटा एवलिया स्मूथ आउटलाइन this is during the first 10 years of life.
Okay.
From 11th onwards this plaque started.
Okay.
Then up to 30-45 years this is called a plaque, atherosclerotic plaque.
Okay.
When the plaque ruptures or there is a thrombosis in the plaque or a plaque erosion, it would a clot hoba. A clot hale circulation kami gala, pain hala, heart attack hala, pain hala. So this whole process is there with each and everybody. This is a process, aging process, and related to other risk factors like blood pressure, diabetes, and cholesterol. Kintu samastan hobo. Kahar earlier habo, kahar later habo. So later will fine, 70-80 years will no problem, 30-40 will problem. So this is the whole process. So we have to halt the progress. Kemti halt kara jibo? Starting the lay upon the atherosclerotic plaque ta jota noram hoita hai. Noram mane soft.
Soft.
Soft jota hai tho seta during hemodynamic trauma blood ta pressure जाउची त सिस्टोल समय जोर जाउची
हाँ.
त उपटा खाइबो
Okay.
कन खाइगला उपटा खाइ रफ हो गला रफ हो गले सेठी क्लॉट तैयार हो से जो उपटा जो एथेरोस्क्लेरोटिक प्लेक रो उपटा को to make it more firm, thick and firm, statin has a role. Statin is not only given only to reduce the cholesterol, it has got lot of other actions. Kintu other ei gote hochi upon plaque ऊपर जोटा smooth covering जोटा था जोटा which is what you call it a vulnerable plaque, जोटा which is vulnerable to break, सेटा को hard कर दबो. So it will prevent it from being broken down during stress, hemodynamic stress, or any other stress situation. So it was main action taro. So it makes a plaque stable. An unstable plaque becomes stable, less likely to rupture, less likely to give a heart attack. So it was tar main kam. Our aspirin kam hala platelet aggregation. जो atherosclerosis disease रे once plaque erosion की rupture हेले सेठी आगे जाके platelet लगिवो. Platelet लगिले तार different platelet adhesion, aggregation, release reaction. ये तीनटा process हुई. ये तीनटा process है कि clot तैयार होगा. So next phase is a need for antiplatelet drug. For primary prevention में जार किसी है ही नहीं. सेठी as I told you, it may not be that effective. But once somebody is having a problem, already developed a heart attack or a stroke or a peripheral vascular disease, each and everybody should have a aspirin or any form of a antiplatelet drug. ଆମର ତିନିଟା ମିଳୁଛି ଏখানে ତିନିଟାରେ ଯେକୌଣସି ଗୋଟେ ବ୍ୟବହାର ହେଇପାରିବ. ତାପରେ ହଉଛି next ହଉଛି ବହୁତ ଲୋକମାନଙ୍କର କମ୍ପ୍ଲେନ୍ ହଉଛି statin ଦଉଛନ୍ତି ମୋର କୋଲେଷ୍ଟ୍ରଲ ନର୍ମାଲ ହେଇଗଲା ଆପଣ still continue କରୁଛନ୍ତି. number 1. number 2, ମୋ ଗୋଡ଼ ହାତ ପେନ୍ ହଉଛି ଇଏ ହଉଛି ମୁଁ ଖାଇବିନି. ଆମର ବହୁତ lot of literature ଅଛି ଏବଂ lot of literature shows it causes also diabetes also and cognitive function ଆମର memory ସବୁ କମ ହେଇଯାଉଛି. କିନ୍ତୁ all are incorrect. All are incorrect because those symptoms are that is more of a subjective symptom than disease. They complain of myalgia, muscle pain, but that is not limiting or restricts the use of a drug. One. Number two, that pass off once somebody goes for exercise, regular exercise, that disappears. Rarely do complications such as rhabdomyolysis, muscle necrosis, that is 1 in 1,000. So very, very rare. In that case, the drug has to be discontinued. Regarding the diabetes part, that is also very rare. If somebody is taking high dose statin or continuously for 3 to 4 years, the chances of developing a diabetes is 5 in 500%. And that is more so those who are having pre-diabetes. So it is also very, very rare.
Yeah.
I think one should not fear that if I take a statin, I will develop a diabetes, I will have myopathy, muscle pains. And so somebody they relate to cataract, somebody say it may also impair the neurocognitive functions. Those are, I think, more or less everything has been sorted out. The amount of benefit it gives, the so-called side effects, I think, is so rare. I think it should not be considered as a contraindication to use of statin to any patient. Only the elderly patient, means those are very elderly, maybe 80 and above years. Seti jetico trials of କରାହେଇଛି ସେଠି so 80 years patient manku represent kara jaini. So seti may be little conservative. 40 instead of 80 milligram one may use 40, but trials say 80 is also as good beneficial to 80 years versus 30 years, 40 years also. So there is no assess, no contraindication except two. One is those who are developing a adverse reaction to the drug, particularly severe myalgia, where blood root enzyme, which is CPK enzyme, muscle enzyme, one may reduce the dose or discontinue. Our has a new concept, what is called a Chinese dose of statin. Our Indian and Asian people, they're more sensitive to the dose of statin. The European country, American, the 80 milligram neve, the 20 milligram novo, our cholesterol level will come down drastically. So that is called a Chinese effect of statin. Okay. The patient tolerate no what you call is a ultra doses of the statins. One may give very 2.5 milligram alternate days, 2.5 milligram 2 to 3 times a week. So this all works. So no need to completely discontinue because the benefit is so large. In that case, it's not wise to discontinue statins. Then is okay, that one. Blood pressure I told you. Then regarding okay, statins I told you. Then is well, what more, madam? You can ask me.
Okay, sir. We can start.
Time is there.
Yeah.
I'll go on anything you can ask me.
Okay, sir. With her question also, it will be answerable.
Okay.
So, ଆମେ sir ସବୁବେଳେ जो pain ଟା କହୁଛେ penetrate होची से pain विषय ଟିକେ ଜାଣିବା sir.
So, what is a typical cardiac pain? ତା ବିଷୟରେ ମୁଁ କହିବି. Typical cardiac pain होची मते देखुथांदो. It starts from the jaws, throat, middle of the chest, up to navel, up to umbilicus to up to the angle of mandible. This is the area where it comes. This is the typical, and it comes particularly in chronic coronary syndrome during physical activity. Chalu chandi, sidi chorchandi, uthan chorchandi. এই এরিয়ারে ডিসকমফর্ট লাগিলা That's it. Once this happens, even all other reports are normal, you should evaluate and investigate in line of coronary artery disease 100%. The chances getting a coronary disease is 90%. At rest, suppose I am getting at rest this type of thing, for the first time also you should give importance. After taking food, I am getting this type of thing, important. At rest, I am fine. Once I take food, I am getting similar thing. That means the food is precipitating the problem. So in that case, it is important. So what is important is, first is the location or site. Number 2 is precipitating factor, postprandial, after taking food or with little exertion, and relief with rest. If these 3 things are qualified, it is going to be 99% cardiac origin of the pain. One. But what is important is a typical presentation. So those things has to be kept in mind, because this type of presentation may not be there in all. 60 to 70%, particularly young people, young लोग जो long standing diabetes अच्छी एक टिके elderly सेमान presentation अलगा हबो. They may have presentation only pain in the arms, pain in the elbow, only elbow, tip of the elbow, pain in the wrist, only breathing difficulty. किसी नहीं, बट क्या धोई से लाऊं, मुझे चले की रास्ते नहीं, लागे ना के पे आज धोई से लगेला, वो खाई साला पर मत धोई से लगेला, unusual sweating, बसी पूरा गम गम होके गाधे पड़ली, unusual sweating है मते, तो चीती सोइले मते comfortable लगेला, बसी वाला पर भल लगेला. ये सब है, these are the variants of heart pain, what you called angina equivalent. एवढा समस्या नहीं पारे, ये जो symptoms है, due importance has to be given. This may be also that. मोट एग्जांपल गोटे देबी आपन बुझ परिबे. जने पेशेंट मोर 10 years back, जने से असले, he came from Tata. He came to hospital evening. But on the left scapula area, a coin shaped area, more 80 pain होची. तो concept area रे अपन ट्रेनर सोइक आसे कोन पेन पेनी तो ना सेटा तो भाबुची तथापि म आछि देखिया पई. तो मुखनो आस्टन जतल कार्डियोलॉजिस्ट देखिया पई बोले ओटा अपन इश्यूज कर दिन हम देखिबा. Unfortunately, that patient had a massive heart attack. He had a VTVF. हम cardiac shock देलो, intubation करलो, primary angioplasty करलो. He became all right, but you can see the variability of the presentation. What a concept area रे left scapular region more pain होची, सही थिले गैस्ट्रिन देखिया पे. तो कहले आपन काहे कि इटा तो हार्ट रिलेटेड भाई लागुनी ना, मु आछि जे तो खड़गपुर मठु टाटारु आछि, काहे कि हला मु बुझाछि. So I feel he must have felt this pain in a different way, but मते explain करछन different. Otherwise कौन सी लोक एमिति टिकनारु गोटे एरिया रे pain टिक हो जासे, whatever may be. So this means the type of presentation is varied. Typical thing is 50-60%. Other things are varied. Sometimes somebody may have only epigastric pain. 8 of part of pain habo, nausea, vomiting habo, jhada jiba pe ichha habo, urge to go to the toilet habo, mundo bule padila bhal lagibo, sweating. All these are varied presentation, but this is more common in diabetics ebong apanଙ୍କର elderly patient man कहले jana. So this is the typical presentation. Any pain in this area, one, then arm pain.
So both the arms,
both the arms, more so left.
Yeah,
Because because unless you tell both, then even right sided pain they ignore. But we see patients with presentation only right hand pain.
yes,
Though it is more common in the left arm, but we can see pain in the right arm also only.
yes.
So this is a characteristic, typical and atypical presentation of cardiac pain. Anything more?
सर आमे जेतले फास्ट एड पढौछु हमकु गोटे सिंबॉलिक कहउछंदी जे हार्ट अटैक जेतबेले हुए एसिडिटी रे जेमति पेन हुए सेमति चेस्ट भितरे गोटे पेन हुए जो पेन टा की पेनिट्रेट करे लेफ्ट साइड रे पूरा तापरे हाथटा पैरालिसिस हो जाए सो व्हाट दैट शुड बी द सिम्पटम एग्जैक्ट सिम्पटम आउ तापरे सेही समय आमे त कोन करबा
ना मैडम देखंतो acidity pain sometimes may mimic cardiac pain, sometimes it may be same also. The question is hyperacidity pain rarely it radiates to the left arm.
Yes.
It won't radiate to the left arm.
No.
It will be in the upper abdomen, this
Yes.
area. So that is the area it will have discomfort, particularly in empty stomach. If you take some food, relief. This is the history. But in cardiac pain, it's just opposite. If you take food, it is more.
Okay.
And radiation is there. But pattern may be when this type of confusing history is there, request is always take a ECG. Don't ignore it. Antacid खाइल तो इतना भला ही गला. तापर फिर रात्रे भला, फिर तापर दिन भला.
Yes.
So in that case, when facilities are there, I think it is better to take only a simple ECG. And if there is a recurrence pain भी हो चाहिए, auto ECG कर दो कि it is inexpensive. Also 50-200 टंका कहीं करीबनी. And you unless you land up with a heart attack with serious complication, ECG कर देबे कम सरी गला.
सर बेले बेले होची जो हार्ट अटैक रे कहउछंदी से हार्ट अटैक रे चली गला सो दैट अटैक इज फर्स्ट टाइम और बिफोर हैंड तर की जे माइल्ड सिंधी की जे प्रॉब्लम हेई थिबो सर
So it is all very simple common sense. Heart attack माने आपण जोटा कहले मैडम ए एक्चुअली एटा बड़ देखाउने ओके हार्ट गोटे आर्टरी बंद हे गला इट मे बी हमर जो आर्टरी এটা হচ্ছে এলএডি
ओके सर
হচ্ছে রাইট এটা সার্কামফারেন্স হার্টর ইম্পর্টেন্ট তিনটা আর্টারি আছে তা ধরে এলএডি সাপ্লাইজ two third of the heart muscle 2/3 so that is called a lifeline সেই আর্টারি যদি বন্ধ হয়ে মূলের বন্ধ হয়ে and আপন মান জানথিবে one of the presentation of a heart attack is sudden cardiac death आर्टरी बंद होला आरिदीमा से जो सडन कार्डियक डेथ रो कारण होची आरिदीमा माने इरेगुलर हार्ट बीटिंग सेटा को आम टर्म में कहा जाए VT and VF VT VF हैला sudden death and unless the patient is being resuscitated by either what you call is advanced life support or cardioversion usually you lose almost all. But there's no time, it is 2 minutes time. If you can resuscitate within 2 minutes, they survive. So that is called one of the presentation of heart attack is sudden cardiac death. Sudden cardiac death. So that is approximately 5 to 7%. So these patients cannot be revived. They won't survive. One. Rest patients जो मन रहिले depending on the duration and severity of the heart attack, then the artery involved, see अनुसार ताकर course होगा. But what is important, मैं go एठी उटा बहुत important question अपन जेत कोई चंदे मु कहबी. Once you suspect or confirm a patient having heart attack, the treatment is urgent. So what is saying achi, time is muscle. If you are not giving treatment in time or on time, it is over. What is over? If you treat the same patient after 2 hours, you will find a different scenario. The heart muscle function is weak, breathing difficulty, then you take the patient to cath lab, do procedure, this, that, all those things, all useless, of no use. So, amar jota question the golden hour of treatment. Unfortunately, I am working on this primary, what you call it, primary PTC and stem. Primary means heart attack hochi, এবং 2 ঘন্টা ভিতরে আপন angioplasty stenting করছেন। So this is called primary angioplasty. যদি করি পারলে the heart muscle যেটি নষ্ট হচ্ছে is minimal. It is minimal. Patient goes back home early with a normal heart. But unfortunately, awareness front of Holokiri Asini, one. Number two, time wasted in acidity, all those things. Number two. Number three, patients, they stay in a remote place, so diagnosis problem. So most of the patients are not getting that benefit, that primary PCI. In metropolitan, we have got a program also, what is called a STEMI India program. It started in Coimbatore and also in Chennai. That is very active in those areas. But because of COVID, it came that period. I was one of the members in that STEMI India project, but it is now stopped. So how to create awareness in people and get the best of the treatment in the golden hour. That is first 120 minutes. If you give the treatment, it is the best treatment. Okay, what maybe there is a limitation because of various socio-economical and also some other regions which are unavoidable. Still then, I think government level it may not be possible. Maybe NGOs and also cardiovascular society, it should create awareness among the people so that the patients get the benefit. Because as I told you, when a heart artery is blocked 100%, that area is destroyed. It is 100%. It does not revive. It doesn't revive. If it is a non-important artery, fine. If it's important artery, main artery, then patients lands up in a LV dysfunction. Only in those conditions, the treatment is customary, maybe cosmetic, stenting, all those. In no way, or maybe it is some, maybe 5-10% benefit to those patients. Otherwise, ଆପଣ ଯଦି ଦେଖିବେ କହିବାର ଅର୍ଥ ହେଲା ଯେ କାର୍ଡିଓଲୋଜିରେ the role of a intervention cardiologist ପଚାରିବେ ମତେ most important is primary PCI. Patient heart attack hochi, mo treatment deli within 2 hours. That is the treatment that saves heart muscle, saves patient's life. One. Next is putting a temporary pacemaker. जो heart rate कमी जाउची चेता पळौची, temporary pacemaker लगाई देले तापर 15 it is life saving. 2. 3. जार heart surface रे पानी जमी जाउची tamponade, immediate treatment is required. You do that, patient life is saved. So maybe 3-4 conditions where intervention cardiology gives dramatic result and saves life and heart muscle. And rest other things, routine procedures, I think there are a lot of controversies whether it helps, does not help. So that I am not going to discuss. But these are the 3 conditions where interventional cardiology has a definite role to save patient life.
CPR ଏଠି କିଛି କାମ କରିବନି sir.
CPR hoche no it will work. It will work definitely. BLS will work definitely because you don't know what has happened to the patient. If you give
Correct message.
cardiac message, which is very important.
Okay.
Many patients you have seen the life is saved. But question is, by the time you bring to the hospital, this is out of hospital resuscitation, out of the hospital cardiac resuscitation. By the time they come, because you have given message, circulation you have maintained.
Yeah.
Airway is not maintained, so by the time he's in the hospital, there is severe anoxic brain damage. We see almost every day. Our rhythm has come back, and treatment has initiated, but he is brain dead. Because 2 minutes interval, adequate ventilation has not been given.
Yeah.
Although there is a severe hypoxic
We
brain.
can, sir, we can give 2 rescue breathing and immediately 30 cardiac message. So if we continue that till the ambulance will arrive, so I think he can be survived.
That cardiac message thing, I'll come back. I think now it is changed.
Okay.
So there is a role of ACB. cardiac compression should be 100 per minute.
Yes.
That only save the patient's circulation.
Okay.
And this one, this respiration, as you told you, maybe 2 per
30.
30 seconds. That is immaterial. But what is important is one has to give cardiac compression primary, this mouth to mouth or intubation if possible.
Yeah.
But long-term patient overall survival will depend on his brain function, his respiratory status, his cardiovascular status. If he's surviving from this, but he's brain dead, then he's a liability for this for the family members. Tracheostomy vegetative, no meaning at all. So what you told, definitely one should try cardiac compression, and present day the cardiac compression is now 100 to 110 beats per minute. And respiration, as you told you, is 2 for 30 seconds. And if ambu bag is available, sometimes I think it is nowadays commonly available. That may also help. So intubation needs a trained personnel, not possible. Unless patient comes to the hospital.
Yes.
If somebody is fortunate, sometimes even a CPR, sometimes the patient's breathing comes.
Yeah.
They survive.
Yeah.
So you have to give BLS must, and the CLS is till it arrives. I think BLS is a must.
Okay. Even if, sir, one doctor, Dr. Vijay Kumar Das, and last 2 to 3 years back, joint director thile, se toilet gale, tapre tanga misses tang dakila bali ko jau nahanti. He is a doctor. So what happened to him? Se jani bhi parile ni nije chali gale.
No, madam, that can happen to anybody. Those who are having a pre-existing heart disease, even if it is coronary artery disease or a cardiomyopathy, where arrhythmia means irregular heart, jota koile VTVF, seta habo. So that he cannot predict. Kintu tar predictors of sudden, we have got a sudden cardiac death protocol is there.
Yes.
The patient who is likely to get a sudden cardiac death or sudden cardiac arrest, jota kohibe, death ta apon good terminology hobe na, am pai seta terminology. Sudden cardiac arrest. So we can know beforehand, we can risk stratify. A group of patients जो हमारा heart muscle function कम अच्छी, कि ये वाला cardiomyopathy अच्छी, ECG रे ये वाला अच्छी. So these patients are more likely to develop a sudden cardiac arrest. So put a ICD. But असुविधा होचे madam. I see what the number of patients we see in our OPD. 50% are eligible for ICD. That is not a cost-effective procedure because ICD are costly. ICD माने हो जे जेतेबेले VTVF हबो सेही समय से machine टा shock देई दबो. So no need to come to the hospital. At home, at toilet, everywhere, it will detect the arrhythmia, give shock then and there. One, plus it has got a backup pacing. Jodi heart rate कमी गले भी pacemaker हिसाब रे काम करिवो. So this machine is given, but consider a costly machine, so not all will afford for that. When we are explaining, discussing the patient, those who can afford we are using, and they are also benefited.
Okay, sir. Thank you very much, sir. Sir, Mr. Dilip Kha, you want to ask any question? Yes, please.
Yeah, good evening, sir. Since I have a cardiologist right in front of me, I have hundreds of questions, but I'm not going to ask you because there are questions from floor as well. I have a major, I am a middle level knowledgeable person about cardiac diseases and stuff because I have a family history and I have been watching these things for many, many years. First thing is I have been taking atorvastatin for last 25 years, 10 mg, and then went to 25 mg, 20 mg. And recently I have added, my doctor added metformin, because I got a little bit of, I think you mentioned a few things that, if you have been taking atorvastatin for a long time, sugar level will go up. And I do not have a history of a sugar family. Nobody has sugar in my family, but still I got it. So metformin is added to that, unfortunately. Dr. Tripathy, you mentioned, or you touched upon so many topics like diet, tobacco and alcohol, and exercise you also did. But what about, like, if you can talk about a little bit of preventive care? How often we should do lipid profile? How often we should do EKG? I have major 4 questions right in front of me, but if you can start with the preventive care, which is,
Okay.
I think, very important.
Okay.
Please.
So regarding that means preventive investigations or consultation. So first is the people or patients, those who are having family history of coronary artery disease 1, family history of premature coronary artery disease. That means in male less than 55 years age or women less than 65 years, there is a history of cardiovascular event 1. Number 2, familial hyperlipidemia. Familial means where the lipids are very high from the birth or after 10 years of age. In those group of patients, I think regarding counseling and testing for cholesterol should begin 20 years onwards, and treatment depending on the level of cholesterol. 1. Number 2 is regarding hypertension and diabetes. As I told you, this is a very pertinent question. Earlier, all these screening programs were done little later, maybe 45, 50, like that. As I told you, when you are getting all these diseases much earlier in Indians and also Asian people, I think we may get all this screening or investigation much earlier, maybe between 20 to 30 years of age. Our Lipid Association of India recommends that lipid profile should be done in each and everybody from 20 to 30 years of age, each individual. And frequency depends on how we are responding to the treatment. If you are on the treatment, if you are not on the treatment, every 6 months interval. Regarding blood pressure, it depends on whether blood pressure is there or not. If it is not there, again, 3 to 6 months interval. As I told you, the fallacies of blood pressure measurement, it has to be home BP recurring, which is very important. And as regards blood sugar, I think if you are a pre-diabetic, if your no diabetes is there, at all blood sugar is normal, and you are 40 years and above, annually once fasting and PPBS and HbA1c. If you are pre-diabetic, it is 6 months interval. And if you're diabetic, depending on your diabetic specialist, you get it checked.
Thank you, doctor. I do the exactly same thing. Every 6 months, I do A1C, lipid profile, and all those things. And depend upon my numbers, doctor prescribes up and down of the medicine. Few more questions I have. As I said, I have 100 questions, but I'm not going to ask. I have 4 questions. Does cholesterol medicine clears the blockage in the arteries eventually?
No. It doesn't clear. As I told you, it stabilizes the plaque. The plaque means the elevation in the internal surface of the coronary artery. This is smooth endothelium. This is a plaque. Plaque means elevated in the inner surface of the artery. This plaque composition is mostly cholesterol, smooth muscle cells, foam cells, and other cells of the blood. But what is important is this cholesterol level. This cholesterol makes this either a stable plaque or an unstable plaque. A unstable plaque gives rise to ACS, that is unstable angina or a heart attack. A stable plaque gives only chronic coronary syndrome. If I walk fast, climb stairs fast, I may get little chest pains, and with rest it disappears. That is a more or less a benign form of a coronary artery disease. So everything depends on the plaque composition. This statins makes a plaque more stable and thick fibrous cap, means which is less liable to for erosion and rupture. So ACS, as I told you, the coronary disease, which is important, is ACS. ACS means acute coronary syndrome, presenting with a heart attack. So that is a life-threatening condition. A chronic coronary syndrome, if somebody is walking 2 kilometers getting chest pain, with rest he is comfortable. You give medicine, that's it, no problem. You can re-stratify those patients later on. You can do angioplasty surgery later on, no problem. He is not going to die. But this ACS patient is at risk of a sudden death.
Understand.
So starting not by reducing the blood cholesterol level, this is one part. But other part is what we call as a pleiotropic effect. Pleiotropic effect means besides lowering the cholesterol level, it has got many effects on the blood components, on the plaque morphology, plaque structure. So that is what is important.
Triglyceride also it reduces. So
Triglyceride statins, no, regarding triglyceride, I think a lot of controversies till today. Triglyceride, we don't look into triglyceride for management of any patients of coronary disease. We don't look. Unless it is more than 500 for prevention of pancreatitis, we give treatment. Otherwise, by treating triglyceride, we are not reducing the incidence of coronary disease. No. We see only LDL cholesterol. Triglyceride has no role. Only it may be taken as a risk enhancer. Risk enhancer means when other risk factors are there, TG is isolated, elevated, LDL being normal. In that case, it may act as a risk enhancers. In those cases, ESC and ACC recommendation varies. According to ACC, if it is persistently more than 175 milligram per DL, give some form of treatment, but usually statin. Statin reduces both LDL cholesterol and also triglyceride. And in European Society of Cardiology, they say if it is persistently more than 150, you can give some form of treatment. But as I told you, the treatment for hypertriglyceridemia varies. There is no standard of care till today. By reducing triglyceride, we are not doing any benefit to the patient, except when it is 500 and above to prevent pancreatitis. That's it.
Understand. Thank you. Next quick question I have is there any medical standard to put stent if blockage is X percentage and above? Because what I'm hearing, Odisha re puri India re dekhuchi, chest pain hele doctor mane 60-70% blockage heichi stent logi douchanti. Is it normal practice or they are just looking for business?
This is a very, I think, very sensitive question to answer. So, but I'll give you scientific basis.
Yes.
What is being practiced, I think, in most of the cases, it should not be. It should not be, because I'll give you two large trials. One is a COURAGE trial, another is a SCMA trial. These are the two trials. COURAGE was a little older trial. SCMA trial is only 3 years old trial. What they did, chronic coronary syndrome. Chronic, as I told you, chronic coronary. Chaluchi, CD chorchi, tique chest pain hochi, rest negli kamigala. it is there for since 2 years, not progressing fine. So question if you are going to do a angiogram, find some blocks, if you treat, whether you are giving benefit to the patient or not. Answer is very difficult to say. Answer is in no way benefiting the patient. Except maybe we are reducing the symptom. That may come down, but if you look at the other aspects, the morbidity, mortality, survival, everything, if you look at that, I think no, we're not doing anything good for the patient. So, as I told you about the sensitive things, so this will not be discussed in detail, not good for professionals, not good for also patients, but patients should know that a small vessel, they should ask also the doctor whether they are doing this procedure, whether in which it is going to help me. That's an important question one must ask. It is very common sense. If a small vessel is occluded 90%, even it occludes 100%, nothing is going to happen. No.
Right.
Nothing will happen unless it is a big proximal part, molar arterial molar disease, significant, more than 60% and above, that needs some treatment. Or there is small vessel, artery blocker, no, let them close down 100%, the pain will disappear. So whatever, there is a lot of controversies, but one thing is sure, a angioplasty or a procedure in a different issue, so whether the benefit is there or not, controversy, lot of work is going on. So you can take it that we're doing some benefit to some group of subset of patients, not all.
Right. So what I'm saying, I have an example in my family itself. Like angiography says that main arteries is blocked for 70%, and doctor is advising stent, and they went through the stent. I don't know. Is there any standard? They should have waited for 90% or 80%. I don't know. And next question I have is, there are different.
Shall we ask a question?
Yeah. One second, Bibo. So another question I have is, which is very important, like these EKG or ECG test, and then echo, and then recently I have been hearing about nuclear test. Those are like giving proper result. Like EKG, I think EKG or ECG doesn't give you any blockage information, does it?
Yes, it gives. No, suppose somebody is getting a heart attack, it gives clear cut all information in ECG. All information will get it from ECG.
What about echo or stress test?
I'll tell you, all are complementary to each other. Not all are important. Not all will be abnormal at a time. Not all will give you the diagnosis. ECG, if somebody is getting a heart attack, what we call ACS, abnormal, that gives diagnosis. That's enough. Over. Echo, in regard of heart attack, if the heart muscle function is involved, we get some information. Or complication of heart attack, then is what you also say? Yes, stress, perfusion imaging. Perfusion imaging, we keep for patients. We do investigations. We find that heart muscle function is weak, or a borderline lesion, or triple vessel disease. Their vessels are bad. Heart muscle function is weak. We go for a perfusion study. Perfusion means, viability study. Whether we see whether the heart muscle is viable, is living. So we see two things. Perfusion means circulation. The circulation houchi, how metabolism houchi, mane living myocardium. परफ्यूजन होनी किंतु मेटाबॉलिज्म अच्छी तार माने हाइबरनेटिंग माइक्रोबियम माने परफ्यूजन जदि आप सर्कुलेशन बढ़ाई देबे हार्ट मसल फंक्शन इंप्रूवमेंट हो जिवो we see this second one. So in viability we see what is called a perfusion metabolism mismatch. Perfusion is not there, metabolism is there, means living is going to improve. This benefit from revascularization, it may be surgery, it may be angioplasty. So limited to each other. Nothing that this test has to be done for this test has to be done for this. No, you have to take all tests together and come to the conclusion.
Understand. Thank you so much. I finished all my
Okay.
questions.
Thank
Over
you.
to Bibu.
मैं रिक्वेस्ट किशोर कुमार जेना प्लीज
सर नमस्ते सर।
किशोर कुमार जेना हाँ प्लीज
सर नमस्कार।
क्वेश्चन दिए हाँ
मॉर्निंग वॉक सर केते किलोमीटर करिया दरकार?
If you've got enough time, you do as many kilometers, as many hours you want. But a standard protocol is 3 to 4 kilometers in 30 minutes. Brisk walk.
ओके सर, थैंक यू सर।
okay
Okay.
and one Jaybir Singh sir please then Bibu
सभी को नमस्कार।
हाँ जयबीर सिंह सर फ्रॉम महाराष्ट्र
सभी को मेरा नमस्ते।
जी
नमस्ते,
मैं महाराष्ट्र से बोल रहा हूँ, जयवीर सिंह। वैसे मूलतः मैं उत्तर प्रदेश एनसीआर दिल्ली से हूँ। डॉक्टर साहब मेरा एक सवाल है, जो मेरा गांव दिल्ली से नॉर्थ साइड में 50 किलोमीटर है यमुना नदी के किनारे। तो जो पिताजी है उनकी उम्र 90 के आसपास चल रही है। सुबह उठते ही वो एक कैप्सूल डाल के उसको लेना पड़ता है। जो जितने हमारे बुजुर्ग हैं वहाँ तो सभी को लेना पड़ता है। हमारी एयर क्वालिटी 400 से ऊपर ही रहती है। तो क्या इसका गलत प्रभाव भी पड़ेगा पिताजी पे हमारे?
कौन सा कैप्सूल?
जो एक कैप्सूल लेते हैं उसमें डालकर उसकी मुंह में लेते हैं, वो एक छोटी सी पाइप सी रहती है, एक कैप्सूल डालते हैं, उसे प्रेशर करते हैं मुंह में सुबह उठते ही, और बीच में दोपहर में भी लेते हैं, शाम को, यानी 2 टाइम तो लेना ही होता है।
That one is what we call is rotahilar, is for asthma. Is it for asthma?
जी हाँ जी जी जी।
Okay. Then आप क्या चाहते हैं?
मैं ये पूछना चाहता हूँ, क्या उसका लंबे टाइम से ले रहे हैं, जैसे 5 साल हो गई, तो क्या उसका कुछ गलत प्रभाव भी पड़ेगा?
Unlikely, unless there is associated. उनका हार्ट का आर्टरी ब्लॉक है, वो रहता है तो असर पड़ता है, क्योंकि ये जो दवाई लेते हैं ना उसमें हार्ट रेट थोड़ा ज्यादा हो जाता है, नंबर 1, और हार्ट बीट इरेगुलर होता है। मेरे ख्याल में ही इज 90 years and is tolerating all this, nothing to worry about that, nothing will happen to him. उनको कुछ नहीं होना है भाई।
जी। और दूसरा मैं पूछ रहा, जैसे हमारी उम्र 50 साल के आसपास है, तो एयर क्वालिटी का कितना हमारे ऊपर प्रभाव पड़ रहा होगा? ये 400 से ऊपर ही एयर क्वालिटी रहती है गांव की। ये जो कहते हैं कि पुराल जल रही है, जनवरी में ही ये होता है, लेकिन नहीं सर, फरवरी में भी इतनी क्वालिटी रहती है, क्योंकि ये पुराल से जलने से हमें नहीं लगता। ये तो राजनीतिक मुद्दे हैं इनके, लेकिन जो पुराल की बात करते हैं, पुराल तो हम जानवरों को खरीद के हरियाणा से खरीदते लेते हैं। मेरा उत्तर प्रदेश बाउंड्री लगता है, तो हम पुराल को खरीदते हैं, उससे दूध बढ़ता है जानवरों में। तो ये जो पुराल की समस्या कहते हैं, फरवरी में भी 450 एयर क्वालिटी रहती है मेरे गांव की, तो हमारे ऊपर इसका क्या बुरा प्रभाव पड़ेगा?
Yes, there's a lot of work in that. I have got less information, knowledge regarding that, regarding the dust and all those things. But it has got adverse, very severe adverse health outcomes. So मैं आपको डिटेल नहीं बता सकता हूँ. I'm sorry.
सर गुड इवनिंग
जी
सर।
धन्यवाद डॉक्टर। दिव्यांशु पाढ़ी
सर गुड इवनिंग।
गुड इवनिंग सर, गुड इवनिंग
सर। इफ यू रिकॉग्नाइज मी, मु बीबी मिश्र कहूଥିଲି सर। आपण मोर एंजियोग्राम करथिले, मु एम्स भुवनेश्वर रे रजिस्ट्रार थिली, जेतेबेला आपण पाखु को आसीथिली, आपण मोर एंजियोग्राम करथिले। सर जानि पड़ते सर?
हाँ जानि सर।
सर देयर आफ्टर आपण मते संगे संगे एडवाइस करथिले जे बाईपास सर्जरी करिया पे, କାରଣ ମଲ୍ଟିପୁଲ ବ୍ଲକେଜ ଥିଲା ଆଉ ମୁଁ ଇନସିଡେଣ୍ଟାଲି ସେତେବେଳେ ଯେହେତୁ ଏମ୍ସ ରେ ଥିଲି ଏମ୍ସ ନ୍ୟୁ ଦିଲ୍ଲୀ ପଳେଇଥିଲି ସାର୍ ଆଣ୍ଡ ଆଇ ହ୍ୟାଡ୍ ଅଣ୍ଡରଗନ୍ ବାଇପାସ୍ ସର୍ଜରୀ 2018 ଅକ୍ଟୋବର 26 ରେ ମୁଁ ଯାଇଥିଲି ଆଉ 28 ରେ ମୋର ଅପରେସନ ହେଇଥିଲା ସାର୍ ବାଇ ଗଡ୍ସ ଗ୍ରେସ୍ ଆଇ ଏମ୍ ବେଟର ନାଉ ମୁଁ ସାର୍ ଦୁଇଟା ଜିନିଷ ଖାଲି ପଚାରିବି କାରଣ ବହୁତ ଜଣ ଅଛନ୍ତି ଅଡିଏନ୍ସ ସେମାନେ ପଚାରିବାକୁ ଚାହୁଁଥିବେ ଗୋଟିଏ ହେଲା ମୋର ଡାଇବେଟିସ୍ ଅଲରେଡି ଥିଲା 5 ବର୍ଷ ହେଲାଣି ମୁଁ ବ୍ୟାଡମିଣ୍ଟନ ଖେଳୁଛି ମୁଁ ଗୋଟେ ସ୍ପ୍ରିଣ୍ଟର ମଧ୍ୟ ଆଜି ବି ଡେଟ୍ ରେ ମଧ୍ୟ 5 କିଲୋମିଟର ଆରାମସେ ୱିଦିନ୍ ହାଫ୍ ଆନ୍ ଆୱାର ରନିଂ କରୁଛି ମୁଁ କଣ୍ଟିନ୍ୟୁଅସ୍ ମେଡିସିନ ବି ନଉଛି ସାର୍ ଆପଣଙ୍କର ଇକୋସ୍ପ୍ରିନ୍ ମତେ କୁହାଯାଇଛି ଲାଇଫ୍ ଲଙ୍ଗ ନେବା ପାଇଁ ଏବଂ ତା ସହିତ ମୁଁ ଇଷ୍ଟାମେଟ୍ ଆଉ ଡାପାଗ୍ଲାଭିନ୍ ଦିଟା ନଉଛି ସାର୍ ସେଇଟା ସଫିସିଏଣ୍ଟ ମୁଁ ମୋର ନର୍ମାଲ ରୁଟିନ ଲାଇଫ୍ ମେଣ୍ଟେନ୍ କରିବି ନା ନାଇଁ ଆଉ କିଛି ମତେ ଚେଞ୍ଜ କରିବାକୁ ପଡିବ ଲାଇଫ ଷ୍ଟାଇଲ ସେଟାକେ
ନଥିଙ୍ଗ ଆପଣ ଡାଇବେଟିସ୍ କଣ୍ଟ୍ରୋଲ ଭଲ ଅଛି
ସାର୍ 199 ଫାଷ୍ଟିଂ ଆଉ 279 ପିପି ରହୁଛି
that is not controlled ସେଟାକୁ ଆପଣ ଯାହାକୁ ଦେଖୁଛନ୍ତି କଣ୍ଟ୍ରୋଲ କରିବେ ଆସ୍ପ୍ରିନ୍ ନଉଛନ୍ତି
ନା ନା ଆସ୍ପିରିନ୍ ନାହିଁ ଆପଣ ଯାହା ମନେ କଲେ ବି ମୁଁ ସେଟା ମୂଳରୁ ବି ନେଇ ନଥିଲି ସାର୍
କାହିଁକି ତାହେଲେ ଆଉ କଣ ନଉଥିବେ ଆପଣ କ୍ଲୋପ୍ରିଡୋଗ୍ରିଲ୍ ନଉଥିବେ
ନା ଦିଟା ନଉଛି ଇନସୁଲିନ ନଉଛି ସାର୍ ମୋର ଫୋର୍ସି
ଆପଣଙ୍କର ହାର୍ଟ ପାଇଁ ଷ୍ଟାଟିନ୍ ପ୍ଲସ୍ କ୍ଲୋପ୍ରିଡୋଗ୍ରିଲ୍ ନଉଥିବେ ଆଉ ଗୋଟେ କିଛି ବ୍ଲଡ ଥିନର ନଉଥିବେ
ବ୍ଲଡ ଥିନର ଇକୋସ୍ପ୍ରିନ୍ ଓନଲି ସାର୍
ନଉଛନ୍ତି ତ
ହଁ
that's okay. That's finished. So nothing to worry about. I think you have to only control your blood sugar. That's it.
ସାର୍ ସାର୍ ଦୁଇଟା ଡିଫରେନ୍ସ ଗୋଟେ ହେଲା ବାଇପାସ୍ ସର୍ଜରୀ ଗୋଟେ ହେଲା ଷ୍ଟେଣ୍ଟ ଲାଗିବା ସାଧାରଣତଃ ଆଜ ଏ କାର୍ଡିଓଲୋଜିଷ୍ଟ ଆପଣ କଣ ମାନେ ଆଡଭାଇସ କରିବେ ଯେ ଷ୍ଟେଣ୍ଟ ଲାଗିବାଟା ଭଲ ନା ବାଇପାସ୍ ହେଇଯିବାଟା ଭଲ
It is very simple, sir. ଶୁଣନ୍ତୁ diabetes patient multiple block ଅଛି surgery is superior to standing clear
Okay.
non diabetic multiple block ଅଛି surgery clear other group of patients you have to discuss case by case that is a shared decision making you have to sit with the patient relation କଥା ହେବେ କାହିଁକି ନା stent ର ତିନିଟା demerit ଅଛି ଗୋଟେ ହଉଛି stent thrombosis 1% ISR जो लगेबे से फिर narrowing होवर चांस होची around 10 to 15% and जो dual and triplet नेबे दीटा blood thinner at least side effect bleeding ticket
Okay.
for another procedure in future if they agree you go for that କିନ୍ତୁ ସାର୍ ଯୋଉଟା କ୍ୱେଶ୍ଚିନ୍ ଗୋଟେ କହୁଥିଲେ ଡକ୍ଟର ଝାନା ଖା ସେଟା କେଚେ ନା
Yes, Dilip Khan.
Dilip Khan.
So he actually he asked for a very pertinent question, but as it was very sensitive, I could not give a complete answer. So because of various reasons, nowadays I don't know. Nobody looks into the ethics, everything.
Yes.
I agree, sir.
If you go for this, you get good result. Surgery, 15 years, there is a extremely good result. Go for that. Then if you recurrence, then we'll see.
Yeah.
But everybody, the patient and also doctor wants a very short-term result. So after maybe if that is good for the patient, we pray God that everything should go for good for the patient because we are there for the patient only. If the patients are not there, we are not there. So I think my personal feeling is you have to give the best of the options to the patient. No harm. Always give the patient because the number of patients are not limited.
Yes.
So for your benefit, you cannot do a practice which may not be helpful on long term. Always give a good options. Let them take a decision, no problem. So because what is important is the benefit.
Yes.
If you get a good long-term benefit, you are happy. You are happy, we are also happy.
Sir.
Right.
The last question,
Is
sir.
there any occurrence further? bypass ହେଲା ପରେ ବି ପୁଣି ଥରେ ହବାର ସମ୍ଭାବନା ଅଛି ସାର୍
Sure. This is first line is this is a incurable disease. First line.
Okay.
এটা କାହିଁ ହେଇଛି ତ ଜଣା ନାହିଁ ନା ଯଦି ଔଷଧ ଦେଲେ ତ ଭଲ ହେଇଯିବ ଆଉ କାହିଁ ଆସିବେ incurable bypass surgery recurrence rate is late 10 years and above stenting re more or less 4-5 years and after it may recur but vessel disease diabetes triple vessel disease non-diabetic bypass surgery.
Okay.
Thank you. Thank you, sir.
And finally, the last question, Dibyanshu Padi, a 9 years old girl, boy. Yes, Dibyanshu.
हेलो मैम मेरे क्वेश्चन है
अनिमा मैडम टिके रह गया दिव्यांशु पचार दो टाइम हे गलानी हमें आउ गोटे लास्ट क्वेश्चन नबा दिव्यांशु और अनिमा मैडम यस दिव्यांशु
सर नमस्कार
दिव्यांशु कोई
सर नमस्कार
नमस्कार
मोर एज अब 48 इयर्स सर मु एबे आपन तो सुनिला परे जानिया पाउची जे मोर रिस्ट टा फ्रीक्वेंटली मोर लेफ्ट रिस्ट और राइट रिस्ट दुइटा को दरज रहउची आ मते स्टेप्स चढ़िला बेलकू माने मोर निश्वास टा टिके ऊपर तळ को होची मते कोन ईसीजी करिया को पड़िबो
आपकर ब्लड प्रेशर डायबिटीज कोची कोंतु
नहीं नहीं सर मोर डायबिटीज नहीं कि बीपी नहीं सर किंतु मोर एज माने मोर वेट होची 75 अछि वेट
हाइट केते कोंतु
मोर 5.4
केते सेंटीमीटर आछी
5.4 inches sir
केते सेंटीमीटर देखंदी केते
54 सेंटीमीटर प्लस
155 centimeters
156 is 7 sir
कोते एते ओवरवेट अछंती यार ओवरवेट बाय 15 kg
सर मु माने रेगुलर मोर वॉकिंग अछि सर इवनिंग वॉकिंग अछि विथ प्राणायाम करछि सर किंतु
it is of no use it does not help you in any way you have to go for a brisk walk भात आलू मीठा फीठा बंद कर देबे रोटी पनीपरिबा साग डाली सलाड फ्रूट्स
सर
गोटे की दीटा पीस माछ गोटे की दीटा पीस चिकन पर वीक ब्रिक्स वॉक करबे
हां सर नॉनवेज तो मु निएनी सर
बढ़िया ना अपन तो ताल कार्बोहाइड्रेट बेसी खाउछन वजन बढ़ुची आ कोन
सर सर एक्चुअली सर ईसीजी करिने भी कि टिके सर या भीतर ईसीजी करिने भी
अपन देखंतु इज नॉट गोइंग टू बी हेल्पफुल फॉर यू किछ दरकार नै यदि अपन चाहउछन करिवे किंतु आई विल सजेस्ट a treadmill for you later on when you can improve your effort tolerance चलाबला टिके बेसी करि परले यदि टीएमटी करिवे that will be helpful ECG all useless
वेरी नाइस अनिमा मैडम पूरी जल्दी जल्दी कर हां
सर नमस्कार
नमस्कार नमस्कार
सर मिस्टर कर मोर डायबिटीज अछि बीपी मध्ये रहउची सर कंट्रोल रहउची सर तंकर कार्डिया किछ प्रॉब्लम नाही कि कोलेस्ट्रॉल मध्ये नॉर्मल रहउची किंतु डॉक्टर का परमिशन अनुसार से डेली रोजडेटेन खाउचंदी
as I told you no 4 group of patients should get statin without lipid profile estimation one is patients with diabetes 40 to 75 years one number 2 LDL cholesterol more than 190 3 आपनकर SCBD score more than 20% statin 7.5 to 20% statin with using cholesterol any patient with diabetes आपन जो कहले आपन हस्बैंड करो he is diabetic he should take a Rosday lifelong 10 or 20 I do not know if his lipid profile level little higher he should take 20 10 low dose
ओके सर ओके
and that is like lifelong and no need to go for lipid profile see my report is normal the doctor is telling to take cholesterol lowering medicine no there's no confusion he has to take lifelong
ओके सर थैंक यू
ओके डॉक्टर प्रियंवदा सामल छत्तीसगढ़ मैडम
नमस्कार सर नमस्कार मैडम
नमस्कार
बहुत सुंदर भाव सर एत बढ़िया कथा कहले कि अधे बुझेला अधे बुझी पालुने तबे आज जो टॉपिक थिला जे टाइम इज लाइफ इटसेल्फ एंड लाइफ रिसाइड्स इन द ह्यूमन हार्ट रियली मोर कविता शीर्षक अछि हृदय को जानो हृदय रख निखुण
नमस्कार सर
କାର୍ଯ୍ୟର ଦକ୍ଷତା ଜୀବନ୍ତ ପ୍ରାଣୀର କାର୍ଯ୍ୟର କ୍ଷମତା ଦକ୍ଷତାର ସ୍ତର ସ୍ୱାସ୍ଥ୍ୟ ଶାରୀରିକ ମାନସିକ ସାମାଜିକ ଆହ୍ୱାନ କ୍ଷୀଣ ଦକ୍ଷ ଖାଦ୍ୟର ଅଭାବ ପ୍ରଦୂଷିତ ପରିବେଶ ମାନବ ଜୀବନ ଶୈଳୀ ଅସନ୍ତୁଳିତ ହେଲେ ବିଭିନ୍ନ ରୋଗର ଶିକାରରେ ହୁଏ ଭାଳି ଅଳସୁଆ ସ୍ୱାସ୍ଥ୍ୟକର ଜୀବନ ହୃଦଘାତ ମାରାତ୍ମକ ମଦ୍ୟପାନ ଧୂମ୍ରପାନ ତେଲ ମସଲା ଅଟେ ଜୀବନ ନାଶକ ଗୁରୁତ୍ୱପୂର୍ଣ୍ଣ ଅଙ୍ଗ ଅଟଇ ହୃଦୟକୁ ଚିହ୍ନ ଜାଣ ଯା ହୃଦୟ ଭଲ ପ୍ରିୟ ପାତ୍ର ସଭିଙ୍କ ହୃଦୟ ଜୀର୍ଣ୍ଣ ମେଦ ବହୁଳତା ଉଚ୍ଚ ରକ୍ତଚାପ ମଧୁମେହ ରୋଗୀ ଗ୍ରାସ ହୃଦୟକୁ କ୍ଷତି ପହଞ୍ଚାଇଥାଏ ମନୁଷ୍ୟ ହୁଆଇ ତ୍ରାସ ଅତ୍ୟଧିକ ଚାପ କାର୍ଯ୍ୟ ଦକ୍ଷତା ଚିନ୍ତା ନିଜ କ୍ୟାରିୟର ଅଧିକ ରୋଜଗାର ସାଙ୍ଗସାଥୀ ବ୍ୟବହାର ଆଘାତ ଆଣେ ହୃଦୟ ସୁଷମ ସନ୍ତୁଳିତ ଖାଦ୍ୟ ପାନୀୟ ବ୍ୟାୟାମ କସରତ ଉପଯୁକ୍ତ ଚିକିତ୍ସା ଡାକ୍ତରଙ୍କ ପରାମର୍ଶ ନେଇ ହେବା ସୁରକ୍ଷିତ ଆମରି ଶରୀର ଆମ ହାତ ସୁସ୍ଥ ରହିବା ସଦା ସଜାଗ ସୁସ୍ଥ ଶରୀର ପ୍ରଥମ ପ୍ରୟୋଜନ ସବୁ ପଛ ସ୍ୱାସ୍ଥ୍ୟ ଆଗ ଧନ୍ୟବାଦ ନମିତା ମ୍ୟାଡାମ କୁ ବହୁତ ଧନ୍ୟବାଦ ଆପଣ ଡାକିଲେ ସାର୍ଙ୍କର ଏତେ ଜିନିଷ ଶୁଣିଲା ପରେ ନିଜେ ବି ଟିକେ କସସ୍ ହେଇଗଲୁ ଆମେ ବହୁତ ବଢିଆ ଭାବରେ ସାର୍ ବୁଝେଇଲେ ବହୁତ ବହୁତ ଧନ୍ୟବାଦ ସାର୍ ନମସ୍କାର
Thank you, madam. ଆପଣ ଯୋଉ କବିତାରେ ଯୋଉ ଗୁଡ଼ିକ ଜିନିଷ କହିଲେ it is mostly all applicable for primary prevention. ବହୁତ ଧନ୍ୟବାଦ ଆପଣଙ୍କୁ ବହୁତ ଭଲ ଭାବେ ଲେଖିଛନ୍ତି।
ମୁଁ ତ ଜଷ୍ଟ ଏମିତି କହିଥିଲି ଆପଣ ତ ବହୁତ ଜିନିଷ କହିଲେ ଏତେ ତ
ସେଟା ତ ସେଟା ସମସ୍ତେ ବୁଝିପାରିବେନି ଆପଣ ଯୋଉଟା କହିଲେ ତ ସମସ୍ତେ ବୁଝିବେ।
Sir, it's a small token of love to you, sir. Please acknowledge. This is a memento on behalf of 185 national winner to Dr. Mahendra Prasad Tripathy, the cardiologist, Care Hospitals, Bhubaneswar, and who joined here as our chief speaker, come research person, and his deliberation is no doubt is wonderful. So everybody, I think, agree with me. So now I'll present a certificate to Dibyansu. That will be afterwards will be signed by our sir. Due to some time problem, I could not able to put the signature. Anyhow, I will request sir, Dr. Mahendra Tripathy sir, to hand over virtually this certificate to Dibyansu Padhi.
Okay.
Yes, sir.
No, of course.
नमिता मु गोटे कथा पचारिबी खाली सर को गोटे मिनिट खाली
Yes. Okay. This is Dr. Sumita. Yes, Dr. Sumita Chakrabarti from West Bengal. Yes, please.
सर नमस्कार सर मोर माने 15 डेज बैक कोन हैला मोर हठात माने लेफ्ट साइड ता चेस्ट रो लेफ्ट साइड ता माने बबलिंग हैला मोर माने पानी फुटिले जेमती हुए जेमती बबलिंग सेंसेशन आसिला आ ता सारे प्रबल पेन हैला सर बहुत पेन हैला मते लागिला मो निश्वास बंद हे जिवो एंती लागिला मु बसी थिली सेते बारे मो माने पोजीशन किछि चेंज करलिनी जेमती बसथिली सेमती मु ट्राई करथुली जे केमती कमिबो सेटा तापरे जा हो माने 5-6 मिनिट एमती हैला सर 5-6 मिनिट जेंति पेन भी हला बबलिंग भी हला तापरे किंतु नेचुरली से निजे कमी गला मु सेंति बसताय से आस्ते आस्ते कमी गला पूरा पूरा कमी गला तो मु ईसीजी करली तापरे मते टिके डाउट लागिला ईसीजी रे सर किछि आसीनी किंतु कोड पई ए सेंसेशन ता हला मु सेटा खाली जानिबा को चाहूची
it happened at rest or बस्तिल हैला ना
आज्ञा आज्ञा सर
आपन ब्लड प्रेशर डायबिटीज कोन अछि
ब्लड प्रेशर माने नॉर्मल अछि मु औषध खाए रेगुलर लो प्रेशर थिला तापरे हठात हाई प्रेशर हैला परे मु औषध खाउची रेगुलर एबे आ डायबिटीज किछि नाही सर
किछि ऑडियो प्रॉब्लम होची बोधे
ओके हाँ सर
हेलो मैडम
यस यस सर
मैडम आपन सेटा एम्प्टी ना आफ्टर टेकिंग फूड हैला
ना किछि नाही मु तो ब्रेकफास्ट खाइतिली सकाळु एटा हला 10टा बेले
okay there is no associated breathing difficulty
हां ब्रीदिंग डिफिकल्टी हला ना
आज्ञा
हां
अजमा नहीं आपन करो
नाही सर
आपन एज केते कहलो 40
57 प्लस सर
7 okay this is your normal I will suggest you should go for a treadmill test later on maybe after 1 week
ओके सर
काइना any gas जति हितंता that give rise to breathing difficulty होउछ माने और
ना सही टाइम पे
later on maybe
ना से सही टाइम तरे टिके मते कष्ट लागिला ब्रीदिंग किंतु तापरे किछि नाही जेंति पेन ता जेंति कमी गला ता संगे ब्रीदिंग प्रॉब्लम ता भी ठीक हे गला
ओके कले संकर सर टिके फ्रीज हे जाई छी रिलोड कले सर कटि जीवे रिलोड कले सर कटि जीवे ओके स्टैंड नाउ द स्टैटिक टाइम है अट्टा को 10 2 आवर्स जॉइन करिवे
सर अछंती के लाइन रे जणा पडुनी
कहांते सर ना
अच्छा कटि गल
सर लेफ्ट जाइछन हां
ओहो
vote of thanks बाकी अछि पुरा
just wait Ashton sir message दूची सर रिकॉर्डिंग चलची ना देची साथ देची सर Ashton दे मैसेज देची अब गोटे मिनिट तो
सर कोनटा मते कहिले करिवा पई
समय सर Ashton टिके
ट्रेडमिल टेस्ट टीएमटी ट्रेडमिल टेस्ट
हो कहि दबो मते सेटा परे
हां हां ये दरकार नियाती
हां कर देबी
ମୁଁ ସେଇଟା କରିଲା ପରେ ହିଁ ମୋର ସବୁ ଜଣା ପଡିଥିଲା, ସେଇଟା ମୁଁ କହିଦେବି ତମକୁ।
ହଁ ହଁ ଠିକ ଅଛି। ହଉ।
ନମି mute ରେ ଅଛ।
ନମି ମ୍ୟୁଟ୍ ଅଛି, ଅନମ୍ୟୁଟ୍ କର।
Okay.
ନମିତା ଅନମ୍ୟୁଟ୍ କର।
She's talking on the phone, not here.
ଓହୋ ଆଚ୍ଛା ଆଚ୍ଛା।
Okay, now it's time to wind up our program. May I request Mr. Dilip Khap from our overseas participant. He'll propose a vote of thanks. May I request Mr. Dilip, please?
Sure.
Yeah.
Thank you, Namita ma'am. Good evening, everyone. Good morning and good afternoon, those who have joined from different time zone, different countries. I was given the opportunity to mention few thanks to our members, our dignitaries, especially our speaker, chief speaker, on behalf of 185 national webinar, title being "Time is Life Itself, and Life Resides in Our Human Heart." Organized by Rover and Ranger Unit of Maharshi College of Natural Law, I have the honor to extend my vote of thanks from core of my heart to Dr. Tripathy, cardiologist, Care Hospital, Bhubaneswar, joined as a chief speaker and resource person for its excellent deliberation. Professor MANJU PATTANAIK, the principal and president of a webinar, must be given a high appreciation for her regular support to conduct such a educative live webinars continuously. Dr. KP Misra, the State Chief Commissioner, Bharat Squads and Guards, Odisha, and Chief Patron of this webinar, is also praiseworthy for patronizing the Rover and Ranger units of Maharshi College to conduct such virtual meetings, not only for the volunteers of the state, but also spreading a new message to the countrymen. Dr.NAMITA PATTANAIK, the moderator, is also deserve a special appreciation from bottom of my heart for organizing different value-based virtual meetings involving both people from India and abroad. Last but not the least, to the respected viewers, I extend my sincere gratitude for their sparing their valuable time to make this program a grand success. My best love and wishes to Divanshu Pari, 9 years old child, who has been actively joining this webinar, and Sweetie Pradhan for their contribution of enchanting slokas. Finally, I bow down my head to Lord Jagannath for giving me an opportunity to propose a vote of thanks to all of you. Thank you all. Over to Namita ma'am.
Thanks goes to also Dr. Priyambada Samal, who has very good poem for us. And recently she has written here only. And it is very on my part to extend not only to Dilip, but also to all the viewers, my heartfelt thanks. And thanks to Lord Jagannath, who has given us an uninterrupted time and network to organize such a wonderful job. And it's really the study of social progress, which is today not less than needed in literature than in the analysis of human art, what I exactly want to conclude here. And again, we may request our very beloved doctor, very, very polite and very affectionate. I know since the last 14 years, I'm touching with him every moment. Whenever I make a call, without any hesitation, he holds the phone, he pick up the phone. That is the good part of a doctor. Is very, very close to all the patient. I just want to tell you, sir, Mr. Dr. Duryodhan Nanda, 2014, ଆମର କମର୍ସ ରେ ଏଚଓଡି ଥିଲେ, ତାଙ୍କର ହାର୍ଟ ରେ ପ୍ରୋବ୍ଲେମ ହେଲା, ଇମିଡିଏଟଲି ଆମେ ସାରଙ୍କ ପାଖକୁ ନେଇଥିଲୁ ଏବଂ ସାର ଅପରେସନ କରିଥିଲେ. ଏଣ୍ଟାयर 15 days I was there with Dr. Nanda and he is also here. ଆଜି ପର୍ଯ୍ୟନ୍ତ ସେ ସୁସ୍ଥ ଅଛନ୍ତି, ସାରଙ୍କର ମେଡିକେସନ ରେ ଅଛନ୍ତି, ବହୁତ ସୁନ୍ଦର. ସାର୍ ଯାହାକୁ ହାତ ଥରେ ଦେଇଛନ୍ତି ସେ ଆଶୀର୍ବାଦ ପାଇଛି ଏବଂ ସେ ହାର୍ଟ କଥା ଆମେ କିଛି କହିପାରିବାନି, ଭଗବାନଙ୍କର ଦାନ, କିନ୍ତୁ ଆମ ପାଖରେ ଭଗବାନ ହଉଛନ୍ତି ଡକ୍ଟର ମହେନ୍ଦ୍ର ତ୍ରିପାଠୀ ସାର୍. ତେଣୁ ଭଗବାନଙ୍କୁ ପାଖରେ ଆମେ ସମସ୍ତେ ପ୍ରାର୍ଥନା କରିବା ଆମ ହାର୍ଟ କୁ ତାଙ୍କ ପାଖରେ ରେଜିଷ୍ଟ୍ରେସନ ରଖିବା ଏବଂ ଆଗାମୀ ଦିନରେ ଆମେ ଗୋଟେ ଭର୍ଚୁଆଲ ନ କରିକିରି offline program kariba so that we can listen to him directly with some models and all that things. Thank you, sir, for being with us once again, sir. Namaskar, and thanks to your family member and your care hospital staff who has given us enough time, and you have also. Thank you, sir. Thank you so much.
Sir, mo treadmill test ta karibi to au kichi nai to? Sir,